No, I think it's actually trying to make that knee-jerk reaction more effective. Because people go to the guy next door who has the same symptom and look at his meds and say, oh yeah, well, I'll go ask my doctor for those, without being truly informed about the complexity of his particular situation. So I think it allows people, as their literacy improves, to go to more reliable sources and manage their health much more effectively, so that they don't have readmissions at hospital or relapses in whatever condition they have.
Is there a part of that too, which is, being informed and making those choices, that it's not necessarily that you have to be on a drug per se to be healthy, but there are other avenues?
Exactly, exactly. And people who increase their health literacy often use the internet as a good source of information, and there are excellent sources of information on the internet, but most of them are written at college or university level. And so that precludes a lot of people who don't have that level of health literacy. There are new sites out there now that actually speak the words as they're being highlighted on the websites. So it's important for people to be able to find those kinds of sites and to use them to acquire the background information they need about their illness, and then to move forward and make informed decisions. Without health literacy, it's impossible to make an informed decision because you don't have all the information you need to make that decision. So it improves decision making. Not only that, it improves your ability to navigate the healthcare system. So if you know that you maybe are being treated locally for a condition that may not be being resolved, you have the savvy to say, I would like to see a specialist at this point, and then you have the ability to actually get to the specialist, right? And to navigate the hospital or the clinic that you're going to, because signage is very difficult in large organizations and hospitals, and people give up. I interviewed a woman who wanted to go to the health unit, and she walked around for 2 hours and never found it.
Oh boy, yeah, it is.
Even navigating the bus routes is difficult for some people, reading the bus schedule.
In the long run, not only will this be a benefit to everyone's health, but I can only assume that there are going to be some cost savings down the road for everyone involved.
Well, we know that the average person in Canada uses about $3,800 in terms of health care. And if you have low health literacy, add another $7,000 to that amount. So you can see that our savings can be dramatic.